The National Health Service, and the 3 Rs: rights, responsibilities, and rising costs. The National Health Service is a group of people who work in the United Kingdom. They establish the healthcare costs and how everyone is able to afford free healthcare. Although, during this action, they still decided to remove the rights of the citizens and take away the free healthcare for oral health. Then, even after not taking responsibility for their actions, later on, taking back their actions. The national healthcare system was established on July 5, 1948 by Aneurin Bevan. Aneurin Bevan, the Minister of Health. Although he established the actual foundation, the Prime Minister, Clement Attlee was one of the biggest inspirations and reasonings for why they were able to accomplish founding it. Attlee started the comprehensive welfare system after being inducted. This system allowed for the accomplishment of many in the United Kingdom, allowing families in need, but in no way of paying for said help. They were given the access by it. This, however, was not the end of the national healthcare system. After Clement left office in 1951, they decided for Sir Winston Churchill. Sir Winston Churchill was inducted into office after Clement left office. Churchill concluded that keeping the National Health Service was a wonderful idea, but they were losing a large portion of their costs in order to keep it going. Ben Bradshaw, representative of the NHS, decided that maybe taking oral healthcare out of the NHS would provide more comfort in the amount of cost they are providing, forgetting about the responsibilities to their people and more about the ability to afford it. The National Health Service is actively trying to find more ways to receive more money than trying to actually care for the people as they had originally intended to for the formation, unable to even follow the creation of the NHS without not even following the standards. The NHS Constitution was created to protect the NHS and ensure it will always do the things it was set up to do when launched in 1948, which is provide high-quality healthcare that is free and for everyone. The National Health Service was formed in 1948 in order to provide healthcare for Great Britain. Over the span of 4 years, the representatives decided to start charging for dental care and other oral health in order to save costs by taking away the rights to the citizens. Although the National Health Service has a responsibility to change the costs, they continue to not take any actions to try and relinquish it. No government will ever refuse to redress real grievances, and a sensible thing I suggest is for the doctors to start this scheme with goodwill. See how it works, then let us review it. And if there are defects, the government will then put them right. Let the House of Commons make this a unanimous appeal to the doctors to come in with good feeling and generosity, and work this scheme when 5th July comes, as it was meant to be worked by the Great Spirit, which gave it its initiation. A quote by Woodburn. The NHS, also known as the National Health Services, whose responsibility it was to make sure everyone had fair costs they were able to provide, and they decided to stop including oral healthcare, such as dentistry, and others due to having limited access to money. This caused them to remove only oral care while keeping the other amounts of healthcare and for a free amount. This act occurred during the climax of World War II, around late 1930s to the late 1940s, after approximately 384,000 soldier deaths and a larger undocumented amount of injuries that came from the war. After the war, many citizens were unable to care and pay for their rights to be healthy. After seeing this, Clement Attlee, the leader of the Labour Party, after Clement was soon nominated the Prime Minister, he took his responsibility and started the NHS, also known as the National Health Services. The political status of Clement allowed him to show to others the good and well prosper that would come from using tax dollars to provide for healthcare. He campaigned with this as one of his largest pieces of information guiding him. This allowed the heart of the NHS to start prospering, known as the comprehensive welfare system. After everything, Attlee, able to impose, many people decided that with his ability to stay dedicated in order for them to be able to also help those who are unable to provide for themselves, which was truly the action of someone who wanted to take responsibility. One of these important people that was involved with this was Aneurin Bevan, the Minister of Health. This is a photograph of Aneurin Bevan and his wife paying his hospital a visit. Bevan is mainly known as the founder of the National Health Service. He was motivated by the fact many citizens were unable to pay and care for their families and themselves after World War II. I know of middle-class families who are mortgaging their future and their children's future because of heavy surgeons' bills and doctors' bills. Many people suffered casualties they would have been able to prevent. This is a quote from a conversation that Anur and Bevan was having talking about the board of the NHS. The second most important person was Attlee Clement. Clement was a war veteran who he and his cabinet both fought and lived through the world wars. This information alone allowed him to understand that many citizens of the UK needed help and they were unable to afford said help. What they needed was a comprehensive welfare system which made use for certain families in need to have access to whatever they required. They even had the responsibility to follow two core important acts that was imposed by the NHS when it was truly established. These acts stated that there should be a comprehensive health service available to all and that it will be free at the point of use. Even though they had the responsibility to follow it, they broke it by worrying about costs and removing oral health care that was meant to be covered by the NHS. Even though Attlee and Bevan paved the way for citizens to have the right to free health care, no matter the costs and no matter what is actively occurring. The short-term impact that truly showed how everything was put together came from taking away the right that the citizens have in order for others to be able to afford for their own care. Especially those who were recently in need and were unable to pay for such an option, other than what was originally processed. The rights and responsibilities of the National Health Services are to care for their community and citizens so they are able to have a good life. When they took away that responsibility, they took away the right away from the citizens. The long-term impact was the degradation and the absolute removal of the responsibility they were meant to have, while also ignoring the right to the health of the teeth of the British. Since many people were constantly unable to pay for their dental care, and without the NHS covering it, they were unable to truly and fully pay for it. Although dentistry in the United Kingdom was still not well contained, the taking of dental health care by the NHS changed significantly the outcomes. The significance is how the government is able to drastically change the outcome and how people are treated throughout their life, even when certain outcomes are destined. The importance is constantly people are saying how British people don't have good dental care, with them always having yellow teeth. Even in movies, actors are typecasted just due to the nature of their teeth and how it can change how they are affected. My topic is connected to today since many people are still struggling to pay for their dental care, causing their teeth to degrade. The rights and responsibilities about how everyone is truly involved with their own health, now they are able to show how people can change everything, especially when they truly need it the most.